join everyone today and introduce Dr. Nette. I've been very impressed with her team at Inspire Health and keep hearing over and over from our patients in the Survivorship Clinic how much benefit they've gotten from the services. And that's really what prompted us today to ask Dr. Nette to come and tell us about her program, tell us about our views and philosophies about survivorship, and so that we can all learn. And as we all know, it's one thing to focus on cancer treatment, but there's an awful lot else that goes on before people are diagnosed if they're previvors, but certainly afterwards in terms of dealing with sequelae of cancer treatment, and not only the physical, but the emotional burden of what has happened to somebody after a cancer diagnosis. So I'm pleased to tell you about Dr. Nette. She's a supportive care physician at Inspire Health. She completed a Bachelor of Science in Psychology at McGill and a medical degree at Dalhousie in 2004, followed by a family practice residency in Halifax and St. John. Her interest in holistic health grew during her years as practicing as a primary care physician, first primary care physician in Vancouver. Working with the Inspire Health team, she's excited to explore healing through patient engagement and empowerment. For those who might not be familiar with Inspire Health, this is a Canadian team and really a leader in integrative cancer care with medical doctors, clinical counselors, dietitians, exercise therapists, all working together to provide patients with support on their cancer journey. And may I say that there are no charges for these wonderful services for patients. The goal is to provide the best care possible to people living with a cancer diagnosis, working with them, their family doctor, and their oncologist. And with that, I'll turn it over to Dr. Nette.
Thank you so much, Lisa, for the warm introduction and the invitation to be here with all of you today. It's really a pleasure. I'm just going to share my screen. And hope that is all where it should be there. Great, thanks for the thumbs up, Stephanie. So it's really a pleasure to be here, and Lisa gave a nice overview just now, really quickly, which I will expand on some of the pieces she just touched on as we go along. I wanted to start by saying that I don't have any disclosures other than I am a contractor for Inspire Health. It's a service contract, and to mitigate any bias that brings up, I just wanted to mention, as Lisa just did, that the services that we provide are free to all patients with cancer and their families or their support people, and we do have a non-pharmacologic approach. We don't sell any products. So I wanted to start by actually presenting a perspective that was printed in the New England Journal of Medicine a few years back. This was written by a gynecologist based out of Australia, Dr. Walker, who wrote about her experience as a clinician, as a researcher, and then as a cancer patient. And she writes beautifully about how she had always appreciated this concept of the receiver operating characteristic curve as a researcher clinician. And when she began her cancer journey, and then had, as many people do, as maybe most people do, quite a complicated course with sepsis and relapsing pneumonia and multiple admissions and insomnia and bone loss and just complication after side effect after sequelae. She found it quite empowering to take her experience and to plot it on this curve. So it's a reimagining of this curve, and she called it her reality of cancer curve. And I thought I actually can't speak nearly as beautifully as she can. So I thought I would actually read a section of this perspective because it so integrates with what we're talking about today. She says, the language of cancer is unhelpfully framed around fighting and winning the battle. Though I had initially signed up as a warrior, my mind was now blatantly writing checks my body couldn't honor, and I didn't feel courageous. I felt like a deserter. I saw in a new light the heartbreak of my patients who believed that if they willed it hard enough, they could ensure a drug-free vaginal birth. The body's betrayal can be absolute, and the punch lands hard. So while these setbacks and their sequelae didn't necessarily threaten my life, they certainly threatened my days. These threats combined forces to become my lived reality of cancer, which was at times exhausting and overwhelming. So she goes on to say that when she was able to kind of grasp this entity, define its boundaries, and nail it to this curve, as she described, she felt much more empowered in this process. The y-axis represents the obvious threat to life imposed by cancer and its treatments. But the x-axis represents the things that threaten to steal our days: treatment and its complications, side effects, a disruption of work and relationships, a sense of vulnerability, the fear that we may be losing our identity. And the area under the curve, this metaphoric curve, becomes the answer to how are you really doing? So then she goes on to speak about how empowering it was for her to realize that by enacting certain things in the areas that she did have control over, whether it was helping to support her sleep or do exercise that worked for her body, she could actually change the area under the curve. She could slide these parameters on the x-axis to the left and shift her experience of what her reality of cancer was. So I thought that nicely framed when we think about Inspire Health and models like this, really in this supportive cancer care space and survivorship care space, what we're trying to do and support for people and provide guidance for people. So I'm going to speak a little bit more about our model of care, and I'm going to sort of speak about the cancer survivorship needs that we see, both that we see at Inspire Health, but also that we see in the literature, the evidence for the approaches that we're providing at Inspire Health, and weaving that in with our programs and services. So as it was mentioned, we've been around for many years, since 1997, 25 years later this year. We've been a nonprofit that entire time. We've been partially funded by the BC Ministry of Health throughout that time as well. It's the Vancouver Centre that was founded 25 years ago. The Victoria Centre is about 10 years this year, and the Kelowna Centre is just a little bit younger than that. And we've been online for years in the sense that we've been providing telehealth and some online programming on a weekly basis prior to COVID. But like many of us, with the big pivot back in April 2020, we did shift to provide all of our programming, both individual and group support online since then. More recently, we've started to offer some of our individual support once again in person, if that's the patient's choice. All of our services and programs and individual support is free of charge, and no referral is required, although I will mention later that it does make a big difference if people and patients with cancer hear about our services from trusted healthcare providers. So just to say that I think this was already mentioned, that we offer support for people with cancer. We do also see people who have a high genetic risk for cancer, but haven't had a cancer diagnosis. Generally, those are people that are hearing about us through programs such as the Hereditary Cancer Program at BC Cancer. We also do provide some support people. We're not funded for support people directly. So we do, most of our support people is them joining our existing programs. And there are only a couple of exceptions to the services that are available for them to join. And I'll mention that as we go. So our programs all emphasize and focus on supporting quality of life. And we are servicing an adult population. That doesn't mean that we wouldn't see, somebody in their late teens who wants to access our services. We don't have a lower age limit cutoff, but our programming is geared towards an adult audience. And why quality of life? Well, it's probably, there's many obvious reasons why, but we do know that that it's a priority that's been identified by many cancer survivors and people, in the midst of a cancer journey, that quality of life is very important. We also know that some studies are starting to show that it does play a potential role in lifespan, cancer recurrence, and potentially even a longer meaningful life. So here's our model in a diagram format, and really thinking about that person-centered approach. The C here is cancer, recognizing and including the important role that the cancer targeted treatments such as chemotherapy, radiation, surgery are playing for actually the vast majority of our patients are receiving one or more or multiple cancer therapeutics, often during the time that they're receiving or accessing our services, and also thinking about all of the other ways that we can support our health, well-being, mental health, physical health throughout the cancer journey and beyond. And we know that that these influence each other as well, as we're going to see in some of the studies. If people can exercise during cancer therapy, during chemotherapy, for example, they can increase the chance that they're going to be able to complete their course of chemotherapy. So, of course, this all has to be done, in ways that most benefit them and that are safe for the individual. So, individualized support is really important. The other thing that this model shows on the left-hand side is the importance of a patient, a person feeling really well supported by a team that's collaborating with each other, and giving that person the guidance and support they need to be their best advocate, and to feel empowered to make their best decisions throughout their process. At Inspire Health, we have these team members, which thankfully Lisa mentioned at the beginning. So I'm one of the physicians. We have exercise therapists, clinical counselors, registered dietitians, and of course an incredible admin and operation team. We all small but mighty team that supports it all to happen. Our services are kind of divided up into two sort of sections, if you will. We have individual support that we provide. Each of those disciplines, those clinical disciplines that I just mentioned, patients have an option of seeing one-on-one for individual support. And then we have 15 to 20 classes every week that happen in all areas that I'm mentioning. So exercise, mindful practices, workshops, self-care workshops, mental health support workshops, nutrition workshops, and cooking classes. So the full range every week, with some education programs sort of dispersed more on a monthly basis. Currently, as I say, the group programs are all virtual, and the platform we use is the one that we're on now, Zoom. So probably all of this is very familiar to everybody here in this room, but I think it's really important to just highlight that survivorship in cancer has changed dramatically over the last 50 years. And where we sit right now is when a person is diagnosed with cancer, if you were to take an average, recognizing that some cancers have higher mortality than others, there's a 5-year cancer survival rate on average of 64%, which is dramatically higher than it was in years past. So we know that there are globally, nationally, increasing number of cancer survivors, and people are living far longer. We all know this, with progressive disease as well. With advanced disease even. So this makes survivorship care, not that it was ever not important, but as more important than ever. And we see all sort of stages of this. If survivorship starts at diagnosis, which is generally the accepted definition of when survivorship starts, all of the possible trajectories going forward. We certainly are seeing all of this at Inspire Health. And just to say, who are our patient demographics? We see our average patient is about 59 years old, so just less than 60. The majority of our patients are 55 or older. So that 55 to 75 is the window where most of our patients sit, although we do see people in their 20s and 30s and 40s as well. The most common stage of cancer is stage 2. We also see people across the trajectory of their journey, but the highest percentages are people who are in active treatment or just completed treatment or post-treatment, and that's the majority, the bulk of the patients we're seeing. We also found, and this is from a patient survey we did about a year ago, that just over a quarter of the patients that we're seeing had either a second cancer or a cancer recurrence. So pulling together several studies to look at what the common issues for cancer survivors are from the literature, it certainly resonates with us when we pull together this list. I mean, this is what we see, that people are coming to a place like Inspire Health for support with all of these things, and I'm not going to read them all out. We would be here all day, but just to say, I put at the bottom just sort of highlighted specifically in the area research-wise of gynecologic cancers. Probably it's not surprising to anybody here to see what's listed there around common issues or common areas of concern. And this is a study, a fairly recent study that I found looking at lived experiences of women who, and quality of life of women who'd experienced or had gynecologic cancer. And just to say, I'm not going to read all this, there's a lot of words on this slide, but just to say that they identified sort of several dimensions. And if we think about, the physical well-being, the mental well-being, the psychological well-being, I mean, that's really, covering the gamut. So when we think about how important it is to integrate all of these areas when we're thinking about supporting, women or patients, people going forward after a cancer experience. I mean, these kinds of studies really bring that home. And this study really emphasized the importance of, the women themselves, the individual getting the support that they needed. So them playing an active role in the process. So I'm now going to go into sort of the different areas, kind of focusing on 3 areas. So exercise, nutrition, and psychosocial support. And I'm going to mention some of the research in that area, but also the services that we provide in that area. But just to say that, there have been many challenges to research in this area. I mean, I think part of the challenge comes from cancer being such a complex and heterogeneous condition or disease. Also, when we study a disease, that's quite a bit potentially easier from a study design perspective than studying an illness experience. And so I think that brings its own challenges. And I'm not a researcher, so I'm humbled to be in the company of many researchers in the room, likely. So, there's probably much more that you could comment on in this area, but certainly just recognizing that there there are challenges. And because of that, many of the studies in this area have been, more observational studies until more recently, when we are seeing, particularly in exercise in cancer care, more prospective cohort studies and even some randomized control trials in the last couple of decades. So really, this is an exploding area of research, and I'm so grateful for that. And just to say that nutrition studies are probably the most challenging area that we look at for a variety of issues that I've kind of mentioned there. It's hard to assign diets, it's hard to adhere and also to collect data that's there's a reporter bias for all of us. So it's a complex area, which I think we probably would all acknowledge. So I'll start with exercise. This is actually a picture. Most of my photos are pre-COVID. This is a spring picture from the rooftop patio at the Vancouver office. This is a Qigong class that took place, as I say, before COVID. So these are two randomized control trials. We actually had an opportunity recently to work with Dr. Don McKenzie, who's a UBC sports med physician and also researcher. And he had been involved in both of these trials, which had sites in Vancouver. And I won't, there's a lot of words on this page, I just realized, but just to say that, the first trial mentioned here is from 2007 and the second one is 2013. And, between those two timeframes, the evolution of exercise in cancer had gone from, this first trial having a usual care group, so a control group, to the second trial not having any control group. In fact, it was recommended that it wasn't ethically appropriate to have a control group for this second trial. So they had a standard group that did 30 minutes of exercise, a high group that did 60, and a combined group that did 30 minutes of aerobic and 30 minutes of resistance. And, we can see that in some cases, one kind of won out over the other for different areas of symptomatology. But just, even the fact that in that time frame, there was enough of a realization that exercise was becoming the standard of care, that there was no control group in that second trial. This is a forest plot, which, as I say, many of you are probably more familiar than me. And it takes many studies and pulls them together. And I think it gives a really quite a profound outline of, and visual, that's the word I'm looking for, a visual of how with all of these studies in different areas of cancer, you're seeing this, this plot to the left of the vertical line here, representing, a positive shift with exercise as the intervention, and the outcome being cancer-specific mortality. On this next, except for this one study here. So, but everything else and the pooled result here at the bottom is shifted to the left. If you look at this other same paper, but just looking at the cancer recurrence or progression, you also see this across the board shift to the left-hand side. This group did research, well, a systematic review where they pulled millions of subjects from many studies, and they looked at many different types of cancer. So in this case, this was they were looking at the relationship between physical activity and the risk of developing cancer. And the next slide is patients that had cancer, and they rated level of evidence, and there were several areas where the level of evidence was strong, and seeing not insignificant risk reductions with, in many cases, a dose response that's positive. So, really quite impressive data pooled here. And this is the, as I said, the next one is in cancer survivors. So we're seeing also a substantial risk reduction in the cancer-specific mortality. And then, of course, because we know that exercise doesn't just help with cancer, we can see that even higher relative risk reductions in all-cause mortality as well. So very busy slide, not expecting anybody to be able to read this, but this is coming out of a group that has released updated guidelines in the last couple of years for exercise in cancer care. And so 2018 was the year that they were produced, which is to say that we're now at the point research-wise and evidence-wise that we can say, this is the dose. This is the exercise prescription in these different cases for these different symptoms, which is just remarkable. I mean, yes, there's still gaps, and you can see that with the moderate evidence, and some of the boxes have insufficient evidence. So still lots to do here, but just the fact that we're this far, we've come this far is really quite incredible. And we now can say that there's strong evidence for prevention in 7 common cancers, including bladder, breast, colon, endometrial, esophageal, kidney, and stomach, and survival data in breast, colon, and prostate. So quite remarkable progress we've made. So I would stand from the rooftops and say that physical activity in cancer populations now represents standard of care. And I think that's the direction that we see everybody going in, and it's really exciting. We can look to our peers in places like Australia and other parts of the world who to work together towards this goal of having physical activity support accessible to all people with cancer. So at Inspire Health, our exercise programs are led by kinesiologists who also have training to be called clinical exercise physiologist, which is typically the terminology that you see that's recommended when people do have a diagnosis like cancer, and they also have additional cancer-specific training. They would see a patient first before a patient engaged in any of the group programs. They need to go through the screening, consultation, and assessment process. They need to have their care individualized to make sure it's appropriate. And if they're interested, and many are, they can be advised as far as how to connect with the group programs. The group programs are wonderful options for getting people moving during, yes, that's really important, or after cancer treatment. And they can learn ways to exercise that are enjoyable for them, and that really leads to, as we can all imagine, sustainability to keep moving going forward. It can help manage side effects of treatment, which I've mentioned, and this is just a little snip from our March schedule, just to say that throughout the week you can see we have many exercise classes. Exercise is far and away the most popular area of our programming, with many different types of exercise. You can see some chair exercise as well, some qigong in the evening. So we're mixing up the timing as well to try to get sort of the most accessible schedule here for people. And this was data from COVID, the first year of COVID, which lined up perfectly with our fiscal year, which started April 2020. And over that year, we saw 34,000 patient visitations, which was more than double what we had seen the year before. So that would be somebody coming in for, an individual visit or an exercise class, or I guess not coming in, joining us online for any of those options, all added up to 34,000, and almost half of that was exercise. So already this year, we're over 3/4 of the way through our fiscal year this year, and we're already above 30,000 for the year. So it's looking like it's even going to be more this fiscal. And we continue to see well, more than 450. I'm just crunching the numbers for this fiscal year as we speak, and it's closer to 550 an average per month that we're seeing, and still more rural and remote patients than we were able to see prior to COVID. So switching gears to nutrition, there's a lot to say about this support that nutrition can provide. Nutritional status is a strong indicator for quality of life. And what I've really learned and appreciated in my years, and I've been with Inspire Health for over 8 years now, is how some of these things can actually they can fly under the radar. People often come to us asking nutrition questions because they feel overwhelmed, they feel stressed every time they walk into the kitchen, they don't know what to eat, they have friends and loved ones telling them this and that, they're reading about something else and everything contradicts, and they're feeling really confused, and that can be the reason that they're coming in. But what we sometimes discover once they come in is that actually there are some issues here. There's some nutritional concerns, some toxicities, some malnutrition. So I think that oftentimes we for the more subtle cases, we don't necessarily have the ability to always pick this up, especially if it's, I say, low grade. But we know that this can make a huge difference over time, and how people do and how quickly they recover. And stress levels, as I mentioned, this can be an area of a lot of stress for people around food. And the thing about food is you have to do it several times a day. You have to eat. So it's not something you can kind of just park and not address on an ongoing basis. So other pieces to mention from the research is that we see positive outcomes in several areas with nutrition therapeutics. And when I say therapeutics, I mean supporting somebody to take in food that works for them and their bodies, and rehabilitative nutrition. I don't mean supplements, although sometimes those are medically indicated, but for the most part, it's about getting what you need from your food. So this is a study a review that looked at 117 studies up until 2016, and this was all types of cancers and survivors. And probably none of this is going to be surprising to anyone. It's like the Mediterranean diet wins again without the red wine. Too bad. But the fruits and vegetables, the fish, low red meat, lots of fiber from the fruits and vegetables. These are the things that we see associated with, inversely associated with mortality. And the only one that seemed to have an association, again, not cause and effect, but association with reduced risk of recurrence was the alcohol connection. Otherwise, they didn't see it impacting recurrence. Again, it's really hard with some of these studies to sort of pin down specific things. It's more so looking at, overall diets, which again is fraught with complications because overall diets are very complex. So this is a World Cancer Research Fund, American Institute for Cancer Research. They are continuously compiling this continuous update project. So it's the largest source of scientific research on cancer prevention and survivorship related to diet, nutrition, and physical activity. They do focus on breast cancer, but it's not exclusively breast cancer related, but that is their focus. And you might be wondering, how are diet and nutrition different? I wondered that. So diet is what we're taking in, what our diet is, and nutrition is things like nutritional status, absorption, malnutrition, those kind of states and parameters. So just to say that. And in 2018, they released a third expert report. And again, probably not anything that anybody's going to be surprised by. There were links to better survival after breast cancer if you had a healthy body weight, if you were physically active, if you were eating foods that contained fiber. Soy was also a positive factor, and having a lower intake of fat overall. So again, quite lined up with the recommendations that we see nutrition-wise for prevention, certainly, and for reduce cancer risk in general. So I think I already mentioned a little bit about why people might come and seek support in this area, and I mentioned that sorting through the madness that can be online research for many people is one of the reasons people come in feeling quite confused and, how do I relate this to myself? How do I make decisions that are best for me? So sometimes people are coming in with quite specific things, is dairy okay? What about meat? What about sugar? So there's a lot of explaining and myth busting that goes on. And then sometimes it's more of that psychosocial aspect, relationship with food and, body image and food and sort of the way that might be playing out for the person, or quite practical things like digestive issues. So really the full range. And our dietitians are here for all of that. So our team is all registered dietitians. They're here for initial visits and follow-ups with patients. Support people can join in. We welcome that, especially if somebody's eating with somebody or maybe somebody's cooking for them. It's really great to have them involved in these conversations. Every week, we also run a nutrition learning workshop and a cooking class. Both happen every week on a variety of topics. We also have a lot of recipes online. See, I'm going to be running short on time soon, so I'm going to pick up my pace. So this is just, again, a clip that didn't have great resolution from our March classes. So just you can see those are all the workshops at the top there and the cooking classes. There's even names of food that I had to look up, and that's, I think I need to attend the March 24th kimchi class. Because that will be learning for me. So lots of variety and lots of options. We choose recipes that are quite simple for the most part. Kimchi may not be everybody's version of simple, but for the most part, these are ingredients that you can find easily at grocery stores for people if they're inspired, and the recipes are all shared. So psychosocial support is kind of the last category, and I just put this in from one of our walks. This was around Oak Bay, and just recognizing that part of the benefit to engaging in supportive care services is that community and that connection with others. I think that's a huge piece that I don't necessarily have a study to support, but I just know it makes such a difference to people. So cancer-related distress is common. It can be persistent for people, and it's certainly one of the most common ways that presents itself is in a fear of recurrence, a perseveration around this. And as I say, it can have wide-ranging effects. It can also show up, in more practical areas. Financial distress, that's real. There are some incredible workshops. In fact, a lot of people that we see really appreciate BC Cancer does some great work in this area to support people around trying to reduce some of their stress financially. and get support for it. And many other, areas that can manifest in this area. A couple of years ago now, in 2018, the Canadian Partnership Against Cancer did a poll or a survey across Canada and looked at cancer care, and the most negatively rated dimension of care in cancer patients was the emotional distress dimension. 7 in 10 reported having emotional challenges after treatment ends, and the fear of recurrence or the worry about cancer returning was the most difficult they found to get help for. So, really important area. And we know that when emotional distress is persistent and, longer term for people, and I mean, so many people are living with cancer now for, extended periods, as we talked about at the beginning. So this is something that it's, as I say, even more important to address. And we know that, quality of life is lowered. People are less likely to have reduced rates of screening and prevention behaviors, reduced treatment adherence, and, may be associated with cancer progression. Again, more research needed, but just really profound, parameters that are showing up in these populations. So this is a study that looked, or another review, again, that's what a lot of these that I'm mentioning today are, from September 2020, that looked at 15 studies, almost 1,500 patients, and the studies 73% of them had, a high quality rating. The studies were mainly looking at mind-body exercise, they called it, and that included yoga, qigong, and tai chi. So that was the focus of this trial, and they looked at many different types of cancer. And what they found was, overall, the mind-body exercise, the yoga and the tai chi and the qigong, had a statistically significant effect on physical fitness, fatigue, sleep quality, depression, anxiety, and BMIs. General quality of life and stress were not statistically significant, but they suggested maybe clinically significant. And then when they broke them down, the subgroup analysis, I'm not going to read them all out, but they saw that, one helped in certain areas. Tai Chi particularly helped with fatigue, and Tai Chi and yoga helped for sleep quality. So, different things kind of played out, but certainly clinically measurable effects to relieve cancer-related symptoms. And this was one that a review that looked at gynecologic cancer particularly, and found, how many studies were there? 28 articles were included, and they found high-level evidence for both the psychosocial educational programs, ones that like sexual health programs to help alleviate symptoms there. The exercise interventions for reducing fatigue, huge, one of the most common long-term effects from cancer. And emerging evidence for CBT, cognitive behavioral therapy, to improve many dimensions of psychological well-being and quality of life, anxiety, depression. So again, things are starting to be demonstrated in the research here. So at Inspire Health, we have both physicians and clinical counselors, and I kind of pooled them together here as far as kind of where we're often navigating waters with patients. Lots of different areas there. I'll highlight sexual health because many times people feel like that's an area that they don't know where to go or who to talk to. I can't count how many sessions that I've spent focused on sleep. Hormonal symptoms such as vasomotor symptoms, menopausal symptoms is a huge area for the physicians at Inspire Health. And so yeah, lots of different areas there that we focus on. So those are probably mostly covered in individual settings with people. And we, as I say, physicians are available for that, and the counselors are here to provide short-term counseling to patients. We also have weekly workshops. We call them inspired conversations. play on our name, that are often have themes in the self-care area or art therapy area. We also have education sessions, 3 mindfulness classes that happen every week. And every month we have a support person workshop to support people, because that's so important to have their own time as well. So again, just a couple of examples from the month that's ahead, March, on the self-care workshops, relaxation and visualization, building resilience. We have a sexual health and cancer workshop mid-month, and a sleep workshop later in the month with one of our physicians. We also are running a 4-week series, and we actually are, through conversations with many colleagues working in this area. This was an area that was identified as a real gap in services, was, after somebody completed treatment and was transitioning back, likely into more of community supports and just with some follow-up at BC Cancer, but not the regular treatments that they had been having. And, navigating that time, it's quite unique. It has its own challenges. So we've called it Life Beyond Cancer, Living Well After Treatment. As I say, it's a 4-week series. We ran it for the first time in February. We had such a wait list for the first time around that we have 2 more programs filled in March and late April, and then we're going to go from there and open it back up to hopefully, as I say, get people who can maybe are hearing about it for the first time at potentially a really important time for them. So very busy. This is just a monthly schedule just to show you all the classes that happen in a run of a week. And then I think I'll just, because the time is running out and I do see some things popping into the chat. Interestingly, when you're in this view, I can't see the chat, but I can see the number increasing. So maybe I'll just skip this, but it's basically just to say that there's a program in Stanford. They haven't done an evaluation recently, but it's a very similar program, and they did a program evaluation and saw some great results from people using this kind of supportive care model. I think I've talked about a lot of these things, that just all the different parameters that we see improved with these interventions. And just to really say, and I tie it back to that first more anecdotal place that I started. We know that empowerment is huge. When people feel that they can be, that they are connected to their strength and their resilience and their tools to navigate through cancer and beyond, we know that every aspect of life going forward improves. So just a note about empowerment in supportive care. We don't require a referral. Patients can self-refer and they won't have any problem accessing our services. But as I say, it does make a big difference. Some patients do require exercise clearance to get started. So we did include that on the physician referral form. So again, if you're sitting with somebody and say, this person, this would be wonderful for them to access, and a little nudge in this direction will really help. When we receive a referral, we reach out. And so those first steps are taken care of for the person. And I think that's it. I'm just wanted to say patients choose where to start and how much to participate. There's nothing's required in that regard. And then I just have to say thank you with my sweet bell peppers. Have to end on a nutrition note there.